My name is Dr. Mehta. I'm an OBGYN that's practicing in South Florida, mainly in Fort Lauderdale and the Aventura area. And I was born and raised here and went to residency in Michigan and have been back in the area for about 4 years now. So I'm trained in general obstetrics and gynecology, but I also have extensive training in minimally invasive surgery. So I do a lot of laparoscopic, robotic surgeries. I do a ton of endometriosis cases, and so that is kind of where my specialty lies. So endometriosis is where the lining of the uterus essentially goes rogue, is another way to say it. So you have the inner lining of the uterus that you have implants from that implant in other areas of the body. And this can cause pain or a lot of pain for patients in many aspects of their life, in intercourse, with bowel movements, and things like that. These implants tend to cause inflammatory responses which cause this pain. The symptoms of endometriosis include pelvic pain, pain with intercourse, painful bowel movements, just generalized chronic pelvic pain. Infertility is a subsequent symptom of it as well. Fibroids are an overgrowth of smooth muscle tissue. So the uterus is made up of 3 layers. You have an outer layer, which is just a thin layer, then you have the muscular layer, and then you have that inner layer that we're talking about that leads to endometriosis. But the smooth muscle layer, you can get an overgrowth of that, and that's what we call a fibroid. The majority of them are benign, but they are these muscular overgrowth of that tissue, and they can distort the cavity of the uterus. The symptoms of fibroids can vary. So a majority of patients that have fibroids are actually asymptomatic. Probably fibroids are as high as maybe 70% of the female population. And a majority of these patients do not know that they have fibroids. A lot of them are incidental findings. However, if you have heavy vaginal bleeding, irregular bleeding, a lot of times you want to rule out a fibroid. Bloating, abdominal distension, pain, problems with urination, all those can be from fibroids or symptoms of fibroids because they can grow and get quite large as well. So fibroids, it depends on, there's really multiple treatment options for fibroids, but if you're doing a surgical treatment, then you're either doing what we call a myomectomy, where you're removing the actual fibroid, and then you're reapproximating the anatomy of the uterus, or a hysterectomy. So with an infertility patient, you would want to do a myomectomy, where you're removing these fibroids because a lot of times they can obstruct the cavity or the uterus from the patient getting pregnant. After that, usually you want the patient to wait up to 6 months before trying to conceive, because that muscle and everything needs to heal. But we don't usually put them on anything extra or any medical therapy after. So the diagnosis of endometriosis is one that you can either do by process of elimination, where you do medical therapy and see if that helps the patient. However, the definitive way to get a diagnosis is by doing a laparoscopy and getting a sample of the tissue and getting a pathology or pathologic diagnosis of the disease. Fibroids are diagnosed by 2 means. You can do a pelvic exam to see if you can feel, but you have to always do some type of imaging study. So the imaging study of choice is a pelvic ultrasound, but you can also grab a CT scan or an MRI to take a look as well. It just really depends what you're trying to do, but the basic would be a pelvic ultrasound. So laparoscopic surgeries, we make a small incision in the belly button, and you go down with the camera and you get to take a look at all the structures, or the pelvic structures. So we get to take a look at the tubes, the ovaries, the backside, the bowel, everything. So you get to look and see, does this patient have endometriosis? Are there any implants? Is there scar tissue, adhesions, things like that? And then also at the same time, you can grab some of that tissue so you can send it so a pathologist can take a look under the microscope, and also you can remove it or treat those things as well. So a hysterectomy, there's different ways that you can do a hysterectomy. You can do it open, where you remove the uterus and the cervix is what we call a hysterectomy, and then you have the option of removing the tubes and the ovaries as well. And that's very patient-specific or dependent. And then you have minimally invasive removal of a hysterectomy, so that's done laparoscopically or robotically, and then you can have it done vaginally. A hysterectomy is where you remove the uterus and the cervix, and then also, like I said, you can decide to remove the tubes and the ovaries at the same time. So the process and steps after an endometriosis surgery or laparoscopic surgery, it's definitely patient dependent. So if someone wants to get pregnant, then usually we don't do anything else. You have a 2-week recovery post-op, and that's just from the surgery in general. But otherwise, then after that, we have you start tracking your cycles, checking for ovulation, and trying to get pregnant. Now, usually after, I usually give the patient about 6 months, and then if they do not get pregnant or conceive within 6 months, you can even go to 12 months after, but usually these patients are trying to get pregnant, and you have a lot of other factors that are going on in their life as well. And so then you can do, ovulation induction, where you can do Clomid as well with their cycles to help them post-surgery. If a patient's not trying to get pregnant, then usually post-surgery you can do continuous oral contraceptive pills where they don't get their period for 3 months, and I usually do that treatment for 3 months, or Lupron, which is a GnRH agonist, which kind of shuts down your cycles completely. And what that does is all that tissue that you've removed and all those surgical adhesions and scarring that you've removed, you allow those to kind of heal, and then also prevent any back bleeding to recur, that process from happening again, or inflammation.